Hello and welcome back to my channel. Today we're talking about essential vocabulary for the topic of medicine and healthcare. This topic appears very frequently in IELTS and TOEFL reading, listening, speaking, and writing tests. If you are at B1 or B2 level, you need to understand medical texts, you need to follow academic lectures, you need to be able to speak clearly about health issues, and you need to write structured answers. So let's begin. The first piece of vocabulary is diagnosis. Diagnosis is a noun. Let's use it in a sentence. Early diagnosis can save lives. The verb is to diagnose. We say diagnose someone important with something. For example, she was diagnosed with ADHD or he was diagnosed with diabetes. Common collocations that might be useful. Early diagnosis, accurate diagnosis. The next one, treatment. Treatment is a noun. It means medical care for an illness. For example, she is receiving treatment for cancer. The verb is to treat, and we say treat someone for something. For example, the doctor treated him for a throat infection. Common collocations. Receive treatment, undergo treatment, effective treatment or ineffective treatment. Symptom. Symptom is a noun. It means a sign of illness. Let's use it in a sentence. A high temperature is a common symptom of flu. Common collocations. You can develop symptoms, show symptoms. You can have mild symptoms or the opposite, severe symptoms. And we say symptoms of, for example, symptoms of anxiety. The next one is infection. Infection is a noun. It means a disease caused by bacteria or viruses. The infection spread quickly. The adjective is infectious. For example, flu is highly infectious. Common collocations, bacterial infection, viral infection, and spread of infection. Disorder. Disorder is a noun. It means a physical or psychological condition. For example, depression is a common mental disorder. Collocations with disorder, mental disorder, eating disorder, neurological disorder, and we say somebody is suffering from a disorder. For example, she is suffering from eating disorder or anxiety disorder. The next one is a pretty useful one, prevention. Prevention is a noun. It means stopping something before it happens. A good thing to do. Let's use it in a sentence. Disease prevention should be a priority. The verb is to prevent. Here we have two important structures, prevent something and prevent someone from doing something. Vaccination prevents serious illnesses, and campaigns prevent people from smoking. Some common collocations, preventive measures, prevent disease, and disease prevention. There are a couple of phrases that can raise your score. Suffer from. She suffers from anxiety disorder. Recover from. Most patients recover from mild infections. Be at risk of. Smokers are at risk of lung cancer. Reduce mortality rates. Vaccination reduces mortality rates. Here's an example of a question you might get. Do you think governments should invest more in preventive healthcare? Here's how you can answer. Yes, I believe governments should prioritize preventive healthcare. Investing in early diagnosis and disease prevention reduces long-term treatment costs and improves quality of life. Preventive measures such as vaccination campaigns and public health education can significantly reduce mortality rates and place less pressure on the healthcare system. At B1 and B2 level, your goal is not to memorize medical textbooks. Your goal is to understand academic vocabulary, control verb patterns, use correct prepositions, and speak clearly and precisely. Your strategy could look like this. You learn the noun, you learn the verb, you learn the preposition, you learn 2 or 3 common collocations, and then you have to use them actively. This is how vocabulary becomes usable in an exam, and this will increase your score. That's it for today. I hope you've learned something new, and if this video was useful, subscribe to my channel, and I'll see you in the next videos.